Hey y'all, my name is Penny Tovar, and for those of you who don't know, I am a bachelor's registered nurse. I was asked by the Ad Council to participate in a collaborative campaign with the CDC to help educate on how we can protect ourselves, our family, and our community to help stop the spread of coronavirus. For credible, reliable, and the most up-to-date information, please go to coronavirus.gov. It was created by the CDC themselves, specifically for the general public. It has a lot of very useful information that is very easy to read and understand, and I highly recommend that everybody at least give it a glimpse. You can actually sign up with your email and you will receive direct emails from the CDC with reliable, credible, and up-to-date information. In the description box down below, I will link the website as well as easy to read PDFs and handouts that you can read and share with others. So in this video, I will be covering 3 topics. Brief overview of what coronavirus is, how to protect yourself and your family and the community, and what to do if you are having symptoms. I'll go ahead and put timestamps right here so you can go ahead and click on whatever it is that you are interested in. So the first section, what exactly is coronavirus? Coronavirus is a new virus strain that has been spreading around the globe, originating from China, and it has been declared a pandemic. Healthcare experts are doing their best to learn more about this virus because it is very new and not very much is known. Symptoms include fever, cough, shortness of breath, bluish lips or face, newly onset confusion, and a persistent pain or pressure in the chest. Symptoms can take 2 to 14 days to appear after exposure. It is possible for you to be infected and pass on the infection without you currently showing any symptoms. And on top of that, reported illnesses have ranged from mild symptoms to severe symptoms and death. The virus is believed to spread from person to person in close contact, which is defined by 6 feet or less. It's contracted by the inhalation of respiratory droplets that are produced by infected persons through a sneeze or cough. The demographic of people who seem to be at higher risk are people over 65 years of age, as well as people who have severe underlying chronic medical conditions such as asthma, diabetes, lung disease, and heart problems. Now, a mentality that I have seen that is very concerning is the idea that, oh, I'm young, I'm healthy, I'm not gonna get infected. Even if I do get infected, I'm not gonna die. While it may be true that young, healthy people will not have severe complications, you can still be a carrier and not know it. I am young, I am healthy. If I do contract coronavirus, it's very possible that I have like a small sneeze, small cough. However, I could pass that on to the immunocompromised children that I'm taking care of, and I can assure you that they will have far more severe consequences than I'm gonna have. Think about your grandma, your great grandpa, your aunt who has COPD, your uncle who has diabetes. It's not just about ensuring our own safety, it's about ensuring the safety of the fragile people in our community. So now that I gave you a brief overview of coronavirus, let's jump into how you can protect yourself, your family, and your community. Probably one of the biggest and most important things that we can all do is to stay home. I know it's not possible for a lot of people to stay at home 100% of the time due to work. Do not leave your house unless you absolutely have to. You can use hashtag #AloneTogether to share some fun ways that you are self-quarantining at home. There are tons of other ways, especially with technology nowadays, that we can communicate with friends and loved ones. You can do FaceTime. And I hang out with my sister and my cousin by playing Roblox on our Xbox, and we talk through our headset. And that's how we just kind of, hang out, have fun together, and catch up with one another. Another important thing to do is to wash your hands properly. You have to wash your hands with soap and warm water for at least 20 seconds. And I know it sounds like common sense, to just wash your hands. But there are techniques and guidelines that you can follow to really get your hands as clean as possible. Please do not rely on hand sanitizers as your main method of cleaning your hands because it does not perform as well as soap and warm water. Hand sanitizer should only be used if you do not have access to soap and warm water. And for hand sanitizer to even be effective to begin with, it has to have at least 60% alcohol content. When you're using hand sanitizer, make sure to cover the surfaces of your entire hand and keep rubbing until the hand sanitizer dries. And I know this is kind of hard, but try not to touch your face. I know it's really hard because sometimes you have like an itch in the corner of your eye, or maybe you have spinach in your teeth and nobody told you. So if you absolutely positively have to touch your face, please wash your hands, and wash your hands after you touch your face. Now, when it comes to face masks, the CDC is actually asking everyone to please not use a face mask if you are healthy, because right now we are experiencing supply shortages in clinics and hospitals. So if you are perfectly healthy and purchasing face masks, that's taking away the supply that we could be using for people who are actually sick, as well as caregivers and medical personnel who are taking care of people who are sick. So for that reason, it is best to stay home at all times and only go outside if you absolutely have to. If you're going to a social gathering, they're recommending that it is no more than 10 people at a time, and to practice social distancing. No hugs, no kisses, minimum of 6 feet between people or 2 arms length. Try to avoid eating at sit-down restaurants. Instead, opt for a drive-through, order something for pickup or for delivery. And lastly, clean and disinfect frequently touched items such as doorknobs, light switches, your phone, sink handles, your computer mouse, your keyboard. And the CDC has some guidelines that you can follow to properly disinfect your home. They also provide a link to a PDF file that is a compiled list of disinfectant products that are pre-approved by the EPA that you can use against coronavirus. So you want to grab your disinfectant product, and on the back it has an EPA registration number. So take the EPA registration number and then check if it's on that list of products. That way you can verify if the product that you are using truly is effective against coronavirus. So what exactly do you do if you start to have symptoms? The obvious answer is to call your doctor. However, please call before you just arrive unannounced. That way that the medical personnel that are going to be helping you, they can take the precautions to protect themselves so they themselves do not become infected. Separate yourself from the people you're living with to decrease the chance of infecting them. Go to a separate bedroom, and if you can, use a separate bathroom. And please wear a mask. This is one of the appropriate times to actually make use of our mask supply because you are experiencing symptoms. And even if you cough or sneeze in your elbow, make sure to wash your hands immediately. Alrighty, y'all, so that is how to protect yourself, your family, and your community from the spread of coronavirus in accordance to the CDC. Like I said before, for reliable, credible, and up-to-date information, please go to coronavirus.gov. Please check out the links in the description box where I have put a bunch of PDF files, handouts, and other useful information that you can use to share on social media. Stay home and stay safe. Bye!